Is it fair to say, with a bit of hindsight, now that we see this explosion in vaping, it's been happening for a couple of years, that your government wasn't quick enough to act? I know Greg Hunt moved to this prescription model, but that has pretty much failed, hasn't it?
Well, I'm not necessarily sure that you say the prescription model has failed. It's been the enforcement of the other requirements and regulations that has failed. And I think that is the point. A prescription model obviously is a way of restricting access, but we also, we have to look at the here and now. We've got 2 million Australians estimated that are currently vaping. If we make access to vapes almost impossible for them overnight, we really do need to be concerned about what happens then. What are the actions that the government's going to put in place to try and deal with black market activity? Because we know inevitably that's what's going to happen. We also have we don't want to see people who are vaping now move to cigarettes because it's easier for them to get cigarettes instead of vape. So, the headline is great, but it's going to be the detail about how this particular measure is implemented on the ground that will tell the difference between its success or failure.
What is the opposition's attitude moving forward on this? Because, these are big reforms. They might not work. The government is going to need to be quite flexible and agile in responding to the way these reforms move the market or change behaviour. Are you pretty much offering bipartisan support on this? Are you willing to throw everything at it?
Well, the one thing I think that as an opposition we'll be very happy to throw everything at is to make sure that access to vapes to young Australians is the number one priority. But what we will be throwing all of our energy and effort, and I certainly will as the Shadow Health Minister, is making sure that what we're doing is actually working and that we are pragmatic and responsive when something may not work, or in the case of the black market, we know that is likely to be an issue, making sure that we are quick to act so that we don't see loopholes and unintended consequences of legislation that may well have the best intention, but making sure it's actually delivering the outcome.
Anne Ruston, thanks so much for your time.
My pleasure. Thanks, Laura.